Assalamualaikum warahmatullahi wabarakatuh. I'm Santi Anugrahsari. Thank you to the committee for giving us the opportunity at the International Conference of Education event to present a research with title The Effectiveness of Educational Video Learning on Patient Safety Knowledge in Clinical Clerkship Student in Teaching Hospital. For the introduction, we try to explain the background of this research. As we all know that in 1999, a report publication with title "To Err is Human, Building a Safer Health System" by the United States Institute of Medicine stated that approximately 44,000 until 98,000 cases were reported related to deaths from preventable medical errors, and they become the third leading cause of death in the United States. On the other hand, the lack of knowledge among medical students regarding patient safety show the lack of efficiency of informal education. Therefore, knowledge about patient safety in clinical students needs to be highly considered, and it requires better policy to improve patient safety. Integrated education about patient safety at all medical and health education level is believed to prevent medical error. The development of patient safety education intervention delivered to resident and medical students increased rapidly. However, there found significant methodological shortcomings, and additional evidence of an impact on the learning outcome is urgently needed. While there is an increase in the effort to promote such intervention, adoption and outreach are the future challenge. Learners face contradiction when learning about patient safety, especially during the transitional phase of their training. This contradiction creates potential learning opportunities that should be used in patient safety education. Understanding the complexity of patient safety is critical for improving education in medicine. This is the international patient safety goals. The first is to identify patient correctly. The second is improve effective communication, then improve the safety of high alert medication, and ensure correct site, correct procedure, and correct patient surgery. The five is reduce risk of healthcare associated infection, and the last is reduce risk of patient harm resulting from falls. There are several studies on patient safety education for clinical students in teaching hospital, for undergraduate students and other health workers. However, only a few previous studies are discussing the appropriate learning methods for clinical students about patient safety. Therefore, this study aims to describe the learning outcome of patient safety education video for clinical clerkship students. And now let me explain about the research method. This research employs the descriptive analytic method. 23 young doctors currently in the eye department rotation at the Satori Teaching Hospital in North Jakarta were given a questionnaire regarding patient safety knowledge by using Google Form. The video is 5 minutes and 7 seconds long. It consists of 6 patient safety goals. This is the result. In the first table, it is explained about clinical clerkship student or young doctor, about perception and satisfaction on patient safety learning video, about the patient safety objective, patient safety goals, identification accuracy, blood transfusion identification, effective communication, definition of drug allergy, drug management to concern, accuracy of location, procedure and patient of the operation, hand hygiene, and knowledge about patient falls. In the table 2, we explain about participant character. Table 2 show that most female clinical clerkship students are aged 21 to 23 years, and most clinical clerkship students have undergone less than 3 new station or co-assistant. In table 3, we found that the evaluation result of patient safety video learning. And in figure 1, we found the percentage of most incorrect answer. The most incorrect answer are associated with patient identification 2, about 65.71%, and drug safety 2, 26.1%. In table 4, we explain the score between the old and new clinical clerkship student. This table concludes that each learning evaluation on clinical clerkship student was according to gender, age, and duration of co-assistant. The statistic results show significant differences in gender, age with p-value 0.00, and duration of co-assistant p-value 0.011, and the clinical student learning score were significantly different according to gender, age, and study period. In the discussion section, we try to discuss the following. The development of time and modern health service suggests the necessity to focus on quality and patient safety for health service providers. The current research describes patient safety learning with videos among clinical clerkship students. It is preliminary research on a more comprehensive future effort. Teaching medical students about patient safety and quality improvement will be effective if integrated into clinical education rather than preclinical course or independent computer modules. Students realize that this topic is prominent for their careers as future doctors regardless of the indeed specialization. They report that their level of knowledge is low and they prefer real-life example and problem-based learning or PBL approach. Attitudes towards patient safety are fundamental because of their profound impact on behavioral decision in clinical setting. Thus, patient safety education should be designed to impose the appropriate attitude. In this study, we examine the learning outcome on patient safety through educational video for clinical clerkship students during the era of offline learning due to the COVID-19 pandemic. It results from that the question will all correct answers were about the purpose of patient safety, patient identification, drug safety, and reduction of patient fall risk. Each of the learning evaluation result among the new clinical clerkship students and those who have gone through a period of more than 4 rotations or out. The statistic results show P 0.011 or less than 0.09. It concludes that the old and new clinical student learning score were significantly different. In the end, we conclude that the learning outcome of clinical clerkship students through video related to patient safety still vary. They differ significantly according to age, gender, and length of rotation. This is a preliminary study that further research how learning outcome before and after learning through educational video with more participants in various teaching hospitals are highly needed. Thank you for your attention. Hopefully it will be useful for education and health in the future. Wassalamualaikum warahmatullahi wabarakatuh.